Hello, my name is Erica, and I will be the moderator during the debate. Our debate topic is as follows. Experimental functional analysis is considered the gold standard in ABA. However, IDEA 2004 mandates that functional behavioral assessments, e.g. descriptive/analog FBAs, be conducted to address maladaptive behaviors in schools. While research confirms the importance of functional analyses in developing treatment interventions for individuals with severe injurious behaviors, others argue that less intrusive, less expensive assessment procedures are as effective in identifying target behaviors and identifying the controlling environmental variables associated with severe behavior. Examine both sides of this issue, research, and develop defensible arguments that consider. First, I would like to introduce my group members. So Jocelyn, if you will please introduce yourself.
Hi, my name's Jocelyn, and I will be arguing in favor of experimental functional behavior analysis.
Katie, if you will please introduce yourself.
Hi, my name is Katie, and I will be arguing in favor of indirect functional behavioral assessment.
After Jocelyn and Katie present their sides, I will then follow up their argument with support from the Behavior Analyst Certification Board Ethics Code. After that, we will then accept questions. Jocelyn will get us started by giving an overview and providing support for experimental functional analysis.
Thank you, Erica. So I'm going to start with the definition of what an experimental functional analysis is. In their 2012 textbook, Applied Behavior Analysis for Teachers, Alberto and Troutman describe a functional behavior analysis as a set of procedures for determining the function of a behavior by systematic manipulation of environmental variables, both antecedents and consequences, and documentation of their effect on the occurrence of the target behavior. Cooper, Heron, and Hayward further explain in their 2008 textbook, Applied Behavior Analysis, that a functional analysis is an analysis of the purposes or the functions of problem behavior, wherein antecedents and consequences, representing those in the person's natural routines, are arranged within an experimental design so that their separate effects on problem behavior can be observed and measured. This typically consists of 4 conditions. 3 text conditions, which are contingent attention, contingent escape, and alone, and a control condition in which problem behavior is expected to be low because reinforcement is freely available and no demands are placed on the person. In their 2006 study, Evaluation of the Treatment Utility of the Analog Functional Analysis and the Structured Descriptive Assessment, English and Anderson discuss some of the advantages of conducting an experimental functional analysis. These include that they are usually being conducted in laboratory or clinical settings, which allow for more experimental control and manipulation with less confounding variables. And also, the demonstration of experimental control is more easily obtained and shown through the systematic manipulation of a small number of variables.
Thank you for that information, Jocelyn. I also know that English and Anderson also explained some of the disadvantages in their study as well. Some of the disadvantages were experimental functional analysis may be limited in their utility as highly trained staff are required to conduct them. Hypotheses derived from an experimental functional analysis may be affected by who conducts the analysis, which can make it really difficult. They may not always identify the variables that maintain behaviors in non-laboratory settings. They are also rarely used by behavior analysts in non-laboratory settings. Back to you, Jocelyn.
Thank you for bringing up those counterpoints. Although it is not a common occurrence, experimental analysis has been shown to be effective outside of laboratory settings. In a study by Sasso et al. In 1992 titled Use of Descriptive and Experimental Analyses to Identify the Functional Properties of Aberrant Behavior in School Settings, the application of experimental functional analysis in a classroom setting is conducted involving experimenters and teachers. The study follows 2 children through the implementation of experimental functional analysis, and then the choosing of a replacement behavior for the interfering behaviors. The study also discusses some of the advantages of experimental functional analysis, including it exerts greater control over the subject's environment during the assessment, permits a more direct assessment of the functional properties of the target behavior, and it can show functional relationships among contingencies, the stimuli associated with them, and maladaptive behavior. Overall, this study is suggesting that experimental analyses conducted outside of typical settings can be valid, and that teachers can be trained to conduct similar analyses within classrooms. This finding suggests that when teachers are shown how to conduct functional analyses and given brief consultation, the acceptance and continued use of such analyses are facilitated. And I will show some visuals as well from this study, including this one and these ones, which show some of the graphs from the study.
Excellent, Jocelyn. Thank you. Sasso et al. Also describes some of the disadvantages to using an experimental functional analysis, and those are as follows. And procedural precision necessary to conduct a functional analysis using analog conditions presents potential limitations. Because stringent control must be exercised, the analysis may not reveal all the events maintaining a behavioral problem in its natural environment. Interventions based on functional analyses may be effective only to the extent that the contingencies and stimuli in the analog conditions match those in the subject's natural environment. Overall, according to a quote from Sasso et al. On page 810, the use of descriptive analyses can allow an initial evaluation of a large number of potentially important variables that can be verified further through a functional analysis.
Thank you, Erica. I would also like to discuss the argument that suggests that conducting an experimental functional analysis requires more training and specialized knowledge than is reasonable to expect of school personnel. It was thought that graduate level education and supervised experience was necessary to be able to conduct a functional analysis. However, multiple studies have since demonstrated that successful training can be completed in as few as 2 hours with participants who range in experience and background, including teachers, school psychologists, and undergraduate students. In their 2000 study titled Skill Acquisition in the Implementation of Functional Analysis Methodology, Iwata et al. Conduct such a study with 11 undergraduate students. The results suggest that basic skills for conducting functional analyses can be acquired quickly by individuals who have relatively little clinical experience. Experimental functional analysis, as the gold standard for functional behavior assessment, is the most precise method of evaluating the function of a behavior.
Thank you, Jocelyn. You made some excellent points. Now we will go to Katie, who will provide support for functional behavioral assessment.
Thank you, Erica. As mentioned, I will be presenting on functional behavior and assessment, and I want to begin just with the definition from Alberto and Troutman. A functional behavior assessment is a set of information gathering strategies and instruments. These tools are concerned with what precedes and what follows a behavior. These are used as a basis for a hypothesis for why a behavior is occurring or what the function of the behavior is. The following questions are attempted to be answered by this tool. Is there a consistent pattern of environmental stimuli, behaviors, or setting events that come before the targeted behavior? Is there a consistent pattern of environmental stimuli, behaviors, or setting events that come after the targeted behavior? And is the student capable of learning an appropriate behavior to replace the function of the behavior being examined? We'd like to begin with Chandler and Dahlquist on how to implement an FBA. First of all, why should you do it? They pointed to it as an ability to cope with challenging behaviors. A challenging behavior has been defined as any behavior that interferes with the child's learning and development or that is harmful to children and others. This can include self-injury, repetitive behaviors, aggression, negative peer interaction, disrupted behavior, tantruming, and noncompliance. Challenging behavior has a higher likelihood of occurrence in individuals with disability. This has been especially evident in the ASD community. This requires a higher amount of provider or caregiver attention, time, and effort. This also decreases time for appropriate behavior promotion and can result in more restrictive measures. Children who engage in challenging behaviors have fewer opportunities for positive social interactions, which can result in isolation and poor self-esteem. Chandler and Dahlquist also point to non-ABA staff as typically being less trained. So they have a failure to address the challenging behaviors and instead apply punishment techniques or ineffective strategies. These interventions do not address the function of the behavior or supply appropriate replacement behaviors. So a functional assessment is a process that assists providers in identifying the factors that produce and support challenging behavior. By using non-punitive measures, they facilitate the development of appropriate behaviors. Chandler and Dahlquist also point to steps needed to complete this. First, you must assess the environmental conditions that set the occasion for and maintain challenging behavior and appropriate behavior. Based on that assessment, you develop a positive individualized intervention plan. Changing the environmental variables that contribute to challenging behavior and providing support for appropriate behavior that achieves the same function as a challenging behavior. This is further supported by Nazu and Nazu in 2015, who also saw that based on this assessment, you can develop a positive individualized intervention plan that changes the environmental variables that contribute to challenging behavior. This plan provides support for appropriate behaviors that achieve the same function of challenging behavior. Chandler and Dahlquist point to the FBA typically occurring following a thorough screening of any confounding variables. This can include physical health screenings, medication reviews, physical impairments, sensory impairments, learning disabilities, or vision screenings. This may take an extensive amount of time, so it can occur concurrently with the FBA. The steps of the FBA may include the behavior consultant employing indirect and or direct information gathering techniques. For indirect measures, the BA can utilize a behavioral interview, behavioral scales or questionnaires, and for direct tools, anecdotal reports, scatterplot analysis, and ABC descriptor data analysis can be used. To go into a little more detail about these measures, a behavioral interview's purpose is to gather as much information as possible about the problem behavior and the environmental and event conditions surrounding it. The interviewer would want to gain information about the topography, the frequency, duration, and timing of the behavior. In addition, they'd want to know what events occur around the behavior. For example, the people present, the activities being attended to, the antecedents, and the consequences. A behavioral interview can be structured or open. Examples of structured include the functional assessment interview, the student-guided functional assessment interview, the student-assisted functional assessment, and the functional assessment checklist for teachers and staff. Behavior rating scales and questionnaires are used to quantify information from interviews. In this format, the interviewees are expected to use some kind of rating scale which correlate to function. These are then accumulated at the end to determine the primary function. As previously stated, examples of behavior rating scales include the problem behavior questionnaire, the motivation assessment scale, the functional analysis screening tool, and the questions about behavioral function assessment. Direct observation techniques include anecdotal reports, which provide a complete description of a student's behavior and the events surrounding it as the observer watches. Scatterplot analysis is helpful for identifying a relationship between a behavior and an environmental condition. The grid format tracks the time, day, occurrence rate, or lack thereof of a behavior. And finally, ABC descriptive analysis differs from the two-step anecdotal by observing and recording behavior in the antecedent behavior consequence format. After this data is collected, it can be evaluated to determine function by establishing patterns. To examine the differences in indirect, direct, and functional analyses, we utilize research between the conditions. Alter, Conroy, Mansell, and Hayden did a comparison of functional behavior assessment methodologies with young children by using descriptive methods and functional analysis with both indirect and direct. The purpose was to compare the outcomes of each to determine validity. Participants included 4 males ranging from 4 to 6 years of age who were identified by their teachers as engaging in challenging behaviors that were interfering with their learning and warranted an FBA. The teacher report form of the child behavior checklist indicated that all 4 participants scored within the at-risk or clinical range for the total problem scale during participant screening. 3 different functional assessment instruments were used for the descriptive assessment procedures, and these included the Functional Assessment Interview, or the FAI, the Motivation Assessment Scale, the MAS, and the Antecedent Behavior Consequence Direct Observation Worksheet. The 4th test was a functional analysis. This study then compared the outcomes of all of these to come to the conclusion that, that how to direct hypothetical functions of target behaviors identified through various discriminating variables. Because FA involves the experimental manipulation of variables, it may be assumed that this procedure more accurately identifies a functional relationship between target behaviors and predictor variables. This being considered, the direct descriptor observations agreed with the FA conclusions for all 4 students. However, the functions identified from the 2 most prevalent indirect descriptive assessments in FBA research, the MAS and the FAI, agreed with the FA results on only 50% and 25 of comparisons respectively. Similarly, the level of agreement between indirect and direct was only 38%. The problems with indirect functional analysis and why caution should be used when evaluating these include limitations that can occur in the informant. The person being interviewed may have limited memory or recollection. There could also be a personal bias, or they may not be able to appropriately verbalize the information needed. Caregivers are also not trained as extensively on the measures being used and may implement or interpret them inaccurately. In our next study, we investigated indirect versus direct versus descriptive functional analysis from Tarbucks, Wilk, Nadowski, Findle-Pays, Belizian, Pavanay, and Tia. In this, they compared indirect functional assessments, direct functional assessments, and functional analyses across 7 children with autism. The purpose was to see how these corresponded with one another and which were found most effective and most reliable. The participants included 7 ASD children who participated from a home-based early extensive behavioral intervention provider. The ages of the participants ranged from 3 to 9, with 6 being male and 1 being female. They also used the 3 types of assessments as the previous study. Further indirect, they used the QABF, which asked 25 questions about a single target behavior based on 5 possible behavior functions that we all know: attention, escape, tangible, sensory, and automatic reinforcement involving physical pain or discomfort. The QABF has been shown to be more reliable than other indirect measures used. For direct, they also employed the ABC format with sessions lasting from 90 to 120 minutes, and inter-observer agreement was followed. And they finally conducted and videotaped a functional analysis with 3 or 4 of the following conditions for attention, demand, tangible, ignore, and play. The indirect and functional analyses procedures produced what the authors interpreted as conclusive findings for all 7 participants, while the descriptive assessments produced conclusive results for only 3 out of 7 participants. These results suggest that at least for the 7 children with autism included in this study, indirect and experimental assessment methods may more reliably produce conclusive results than descriptive assessments. The authors then discussed some advantages and disadvantages of each approach accompanied with considerations. So, direct advantages of descriptive assessments. They allow the assessor to observe the behavior in the environment in which it naturally occurs, thereby allowing for their opportunity to record a multitude of variables which may be relevant to the behavior. However, the behavior may not occur during observation periods. An accurate recording of antecedents and consequences may require a significant amount of training. The relations between behavior and environment, which are demonstrated, are only correlational and may not actually reveal the function of the behavior. And the caregivers may not act as typical while being observed, which can skew results. Advantages of the indirect assessments: they are rapid, they're easy to administer, they do not require direct observation of the target behavior, and they require less than an hour to conduct. There is, however, a significant amount of research that has found inconsistent reliability. The authors also pointed to a consideration being made for time. As mentioned previously, the indirect methods are much quicker, with most reporting in this study that it took them 20 minutes to complete, whereas the direct descriptive assessments took about 90 to 120 minutes of client contact time. Now, this varies to the 4+ hours of the functional analysis time. This article also cited various comparison studies between functional analyses and other assessment types. When Sasso et al. Compared results of ABC data to the findings of functional analysis on the same subject, they demonstrated descriptive and FA produced similar results in the challenge behavior of 2 children with autism. Mace and Lai, they showed that differences in the descriptive assessment versus FA in regards to the function of the behavior and found a correlation between the two in reliability. And I believe we have some visuals from this article.
Yes, let me pull it. Some of these visuals include the summary of the indirect and descriptive experimental functional analysis results. So it shows the different results of the assessments. And also there are some graphs here that show the QABF versus the experimental functional analysis and the descriptive functional analysis for the participant's aggression. And then there's a simplified version of the functional behavior pathway that I think was also referenced in this article. As well as a graphic of possible functions of behavior and how to find a functional replacement behavior. Thank you. Back to you, Erica.
Thank you, Katie, for all of your great information. And now I think that part of our hypothesis that I would like to point out is that while both of the above are effective, I think that the evidence that we've found points that functional behavior assessments are the less intrusive, and due to them being completed in the student's natural environment, may be less intrusive and less stressful for the students, and point to a more clear function of the behavior. However, I do think that it is possible sometimes that a behavior cannot be found using a functional behavior assessment. And in that case, we have determined as a group that a functional analysis would then need to be completed. But that in the beginning, a functional behavior assessment could be completed to try to identify the target of the behavior. And so our hypothesis can also be supported by the Behavior Analysis Certification Board Ethics Code. So according to the Ethics Code, 2.09a states that clients have a right to if it is research-based and is the most effective treatment for the client. The following part of that in 2.09c states that when there is may consider additional factors when choosing the most effective treatment, including efficiency and cost effectiveness, the risks and side effects of the interventions, the client's preference, which is a really big one, and practitioner experience and training. As we know in the ethics code, we can only practice within our education and our experience. Before starting a behavior change program, Code 3.01 states that assessments must be conducted before behavior analysts make any recommendations or develop a behavior change program. The type of assessment should be determined by the needs and consent of the client, the environmental parameters, and other circumstances. These should all be evaluated before deciding on a functional behavior assessment or a functional analysis. In conclusion, we have determined that ethically functional behavior assessments are the best type of assessment to use with clients if they will effectively identify the function of the behavior. And now we will take questions, and I believe that we have received 2. Our first question is as follows. As a BCBA, you are working with a child in school with very significant behavior that is difficult to find the function for. You inform the teachers and parents of the need for an FA, analog or trial-based, but the parents say that they have heard FAs can increase the behavior or reinforce it. So they request that only an FBA is done without an FA. How would you handle this situation using the points you made in your debate as well as the ethical codes? Jocelyn, I believe you had the answer to this question.
Thank you, Erica. I would respond to the parents as such. I'd tell them, thank you for sharing your concern about the implementation of an FA for your child. Cooper, Heron, and Hayward described the functional analysis as an analysis of the purposes or the functions of the problem behavior by arranging and manipulating the events both before and after a problem behavior occurs or may occur in a natural routine or environment. The experimental design allows for the separate effects on the problem behavior to be observed and measured. The benefits of an FA can be seen across many studies, including English and Anderson's 2006 study, Sasso et al.'s 2006 study, among others. English and Anderson emphasize that the systematic manipulation of a small number of variables allows for a demonstration of functional control. This will allow for us to be sure of what the function of your child's behavior is before we begin implementing a treatment. Although it may take more time to complete the FA, the trained team will be able to create an individualized plan to decrease your child's problem behaviors, as described by the BACB's Ethical Code 4.03, which states, which is about individualized behavior change programs. In their 2009 study, Wilkie et al. Write that a significant amount of research has found inconsistent reliability in the findings from indirect assessment. Due to the significant nature of the behavior your child is exhibiting and the complexity of finding the function or purpose of the behavior, it would be most beneficial to conduct an FA to be sure that the treatment we are implementing will be the most beneficial. The Behavior Analyst Certification Board also write that behavior analysts always have the obligation to advocate for and educate the client about scientifically supported, most effective treatment procedures. Effective treatment procedures have been validated as having both long-term and short-term benefits to the clients and society. By conducting an FA, we will be able to support your child with long-term benefits. The BACB's ethical code also writes that when behavior analysts are developing a behavior reduction program, they must first conduct a functional assessment. From an ethical standpoint, we want to conduct an FA to be sure of the function prior to developing the treatment plan.
Excellent, Jocelyn. Thank you for that answer. I think our last question goes as follows. Has anyone in your group taken part in implementing an FBA and been an observer or supervisee who has conducted an FA? Do you think it was necessary to complete the FA, or could it have been done just as easily with a less intrusive FBA without the FA? Explain why. Personally, I have not taken part in implementing an FBA or been an observer of an FA. Jocelyn or Katie, have either of you?
I have not either. Katie?
I have actually implemented an FBA and observed an FA, and I can see both sides of this argument to a degree. The FBA was completed in a less amount of time with indirect measures being used. After an MAS was administered, the function of the behavior as attention was determined for the behavior of shouting out obscenities during lecture. Once an appropriate replacement behavior was established and implemented, the challenging behavior decreased, and the child easily adjusted to his program. The FA was conducted for an 18-year-old who would hit his head against objects when presented with a task. Luckily, the consumer wore a safety device to ensure blows would cause less to no damage to the body. The FBA would have been quicker in this case, but the FA did determine the appropriate function leading to an effective treatment with this consumer. The behavior decreased when the behavior plan was implemented for this consumer and ensured the safety. For each of these considerations, effective treatment was implemented in compliance with Code 2.09. Furthermore, the purpose of the behavior was twofold, but may lead to function in 3.04. In the first and second example, we were able to determine the most effective procedures while creating an ethically behavior reduction plan. Considering my experience, when possible, the FBA should be utilized to minimize time, money, and undue impact on the consumer. However, an FA may be needed to determine further functions.
Thank you, Katie. That was an excellent example. That is all of the questions we have received, and we would like to thank you all for tuning in and watching our debate. Thank you very much.